Today we're going to talk about outpatient burn care. With advances in outpatient surgery and access to specialized burn clinics, many patients can now receive excellent burn care outside the hospital. This includes treatment for minor burns and follow-up care for patients who have survived more serious injuries and are transitioning back to their daily lives. The goals of outpatient burn care are broad. They include wound management, pain control, scar care, reconstructive follow-up, psychosocial support, and ongoing rehabilitation. For some patients, outpatient care means dressing changes and physical therapy. For others, it means learning how to adapt emotionally, socially, and even spiritually to life after a burn. Not every patient is a candidate for outpatient management. Several factors must be considered: the patient's age, medical history, the depth and extent of the burn, and where on the body the injury occurred. Equally important are support systems. Does the patient have reliable family members or caregivers at home? Do they have access to community resources, transportation to and from the clinic, and the ability and willingness to follow through with a therapeutic regimen? Outpatient care requires commitment, not just from the patient, but from their support network as well. Education is a huge part of outpatient burn care. Patients and families need to understand how the burn affects the body, daily activities, roles, and relationships. They need clear instructions on how to contact the treatment team, including nurses, physicians, therapists, social workers, and even medical supply vendors. They also need a full grasp of their medications, the names, doses, schedules, and potential side effects. Psychosocial care is equally critical. Many patients experience nightmares, flashbacks, or ongoing emotional distress after a burn. They should know this is common and that it's okay to ask for help. Support groups, community programs, books, videos, and online resources can provide connection and hope. For children, school reintegration programs can smooth the return to learning. For adults, vocational rehab programs can ease the transition back to work. Financial concerns can't be ignored. Burn care is expensive. Dressings, medications, and therapies add up quickly. Social workers and case managers play a key role in connecting patients with funding assistance programs when needed. Another essential part of outpatient education is home safety and skin precautions. Burned skin is delicate, easily injured, and very sensitive to sunlight. Patients are instructed to use the strongest possible sunscreen, wear protective clothing, and use wide-brimmed hats if the face or ears are affected. They should avoid tight clothing, colored fabrics that may irritate, or garments that restrict movement. Cotton, loose-fitting clothing is usually best. They are also taught to lubricate healed skin with mild lotions, avoid scratching, and protect fragile areas from trauma. Wound care at home is a major responsibility. Patients are taught to take pain medicine 30 minutes before dressing changes, to clean wounds gently with mild soap and water, and to apply prescribed medications and dressings exactly as instructed. They need to watch closely for signs of infection, such as redness, swelling, drainage, or foul odor. Rehabilitation doesn't stop once the wound is closed. Patients should perform as much of their own care as possible, follow exercise regimens from physical and occupational therapy, and elevate swollen limbs when resting. Fatigue is normal, so rest and sleep are essential. Nutrition and hydration matter too. Nutrient-rich foods support healing, and fluids help prevent constipation caused by pain medicines. Scar management is another vital topic. Patients may be advised to massage healing areas with mild lotions, wear compression garments up to 23 hours a day, and understand that skin discoloration may last many months. And yes, we also talk about intimacy. Many patients wonder about resuming sexual relationships. The truth is, most patients do resume intimacy, and sensitivity in affected areas will improve over time. This topic should be discussed openly without stigma. Assistive devices may be required, from splints and walkers to shower chairs and grab bars. Patients and families need to know how to use and maintain these tools correctly. Follow-up appointments are critical, especially in the first few weeks. Typically, the first visit is scheduled within 3 to 5 days after discharge. Over time, visits become less frequent, but remain important for long-term recovery. During outpatient visits, the healthcare team also monitors emotional health. Depression, PTSD, substance abuse, and suicidal thoughts can be difficult to detect in short visits, but they are common and must not be overlooked. Including family members in assessments often helps reveal problems that patients themselves may minimize. So, outpatient burn care is about more than changing dressings. It's about teaching patients and families how to live with and beyond the injury. It's about supporting recovery across every dimension: physical, emotional, social, and spiritual. It's about making sure patients are not just surviving, but truly rebuilding their lives.